Hello, my name is Denise Lugo, and in this presentation I will be evaluating if a robot surgeon can be trusted to operate. A combination of different applications of surgical robots and computer-assisted systems have been developed to benefit medicine with respect to surgery. Surgery has renovated itself significantly over the past couple of years, adopting robot surgeons all over the world. I'm going to first start off with an explanation to what are robotic surgeons, as well as their brief history in medicine. Then I'm going to provide an insight to where you can expect to see the use of robotic surgeons, followed by a list of advantages and disadvantages of robotic surgeons. And last but not least, we will answer our core question of can a robot surgeon be trusted to operate? But first, what are robot surgeons? Robot surgeons are medical robots that assist physicians by enhancing their capabilities such as improving precision, a surgery's invasiveness, a physician's dexterity, and the patient's recovery period. A physician is able to perform a surgery on a patient with the help of a medical robot, providing steadier and smoother movements, reducing the damage of body tissue during surgery and open surgical procedures. These systems are equipped with fine instruments attached to the robot arms, high-resolution, three-dimensional visual systems, and the ability to mimic wrist-type motions. Here's a brief history. In 1985, the first robotic-assisted surgery was performed by the Puma 560, which is shown on the right, and it was used to perform a neurosurgical biopsy with more precision. In 1988, the ProBot was developed by Imperial College London, which was utilized to perform prosthetic surgery with image guiding, simulation, and online video monitoring to specifically aid in resection of prosthetic tissue. The 1990s brought about the Robotic, which creates precise fittings in the femur to ensure perfect hip replacement. And one of the latest systems include the Da Vinci surgical system, which in the US performed more than 8,000 prostatectomies in 2004. Below, I have a list of areas where you can expect to see robot-assisted surgery. For instance, in cardiac surgery, it is seen during mitral valve repair or cutting cancerous tissue from blood vessels and nerves, or in gastrointestinal surgery with the removal of the gallbladder, in gynecology with the hysterectomy, all the way down to urology, which involves the removal or transplant of the kidney and many more. A robot surgeon's greatest advantage is the ability to be less invasive, which provides patients with smaller scars, less blood loss, and reduced trauma to the body, faster recovery, and shorter hospital stay. Robotic surgeons increase precision and dexterity in physicians, which minimize random errors and improve the coordination of small muscles and movements. It's also less strain on the body, since because of the use of robotic systems require a physician to sit behind a console without having to stand up looking down at a patient. This technique decreases the fatigue that doctors experience during highly complex surgeries that may and can last several hours, filtering hand tremors, restless legs, and neck and back strains, all of which can affect a human's performance, especially in surgery. It also provides flexibility by allowing physicians to work at great distance. Surgeons working in New York have successfully used remotely controlled robots to laparoscopically remove a gallbladder from a 68-year-old woman in France. This all ties into happy patients, happy career. Now let's talk about the disadvantages. The disadvantages include malfunction during surgery. The arms of robots used for performing robotic surgery are made up of tough plastics. It has been noted that tear in this plastic tip causes electrical arcing, which often causes severe injury in patients during surgery. It's also extremely expensive in terms of capital costs as well as running expenses, and will require the training of specialized personnel to properly repair and care for these machines. Latency is also a disadvantage, which is the time delay between the instructions issued by the surgeon and the movement of the robot which responds to the instructions. In this slide, you'll be shown a video showing a computer system identifying cancerous tissue and guiding the robot to remove them. The first video shows a linear cancerous tissue being removed. That experiment had 5 trials with all of them being successful. In the second video, you are shown randomly placed spherical cancerous tissue being removed. This experiment had 50 trials with a 96% success rate. The last video shows a robot cutting in a circular pattern where the first robotic arm stretches the area and the second cuts around it. So, can a robot surgeon be trusted? The revolution of the surgical practice has graded the chances for betterment in surgery by improving and expanding highly complex surgeries and advancing surgical technology. Although robotic surgery is in its preliminary stages, it's proven great benefits in complex surgical procedures. The use of robot surgeons allow for small incisions, less blood loss, a decrease in infection rates, and reduction of the recovery period. Robotic technology expands surgical treatment modalities beyond the limits of human ability, exceeding the expectations of its advantage in medicine for all involved. Furthermore, robotic surgeons are equipped to provide physicians with better visualization, greater dexterity, with fewer tremors, and physician flexibility. Approximately 400,000 robotic surgeries were performed across all types of surgery in the U.S. in 2012. For hysterectomies performed in the U.S., the utilization of robot-assisted surgery increased from 0.5% in 2007 to 9.5% in 2010. Blood transfusion rates during robotic surgeries can be near 0%. Compare this to open surgery, blood transfusion rates may be up to 40%. Robotic surgeons have been around for many years and are only getting more advanced. It is clear to say that robot surgeons can be trusted for their ability to provide more accurate and enhanced outcomes. Thank you for taking your time and watching my slide. If you have any questions or comments, now is the time.